Welcome to my presentation on discovering autism. My name is Andrea Hart, and today we will explore autism spectrum disorder. We will look at what it is, how it affects individuals, how it is diagnosed, strategies for teachers working with students on the spectrum, and some fascinating facts about the disorder. So, what is autism? Autism is considered a spectrum disorder because it affects everyone in a unique way. The National Institute of Mental Health defines autism spectrum disorder as a neurological and developmental disorder that affects how people interact with others, communicate, learn, and behave. Although autism can be diagnosed at any age, it is categorized as a developmental disorder because symptoms typically appear in the first 2 years of life. However, the symptoms of autism can change over time, and as individuals grow, they may develop new skills or require different kinds of support. I would also like to note that although the signs of autism are usually noticed in early childhood, the diagnosis does not always happen immediately. Many individuals aren't diagnosed until later in life when their unique traits become more noticeable in social or educational settings. Characteristics for autism include social communication and social interaction challenges. For instance, a person with autism might struggle to recognize when someone is upset based on their facial expression or tone of voice. Additionally, repetitive and restricted behaviors can be common. An example of a repetitive behavior in autism could be engaging in repetitive activity like hand flapping or rocking back and forth. Similarly, people with autism often stick to strict routines. For example, they might want to eat the same food every day and get upset if their routine is thrown off. Also, they can have an over or under sensitivity to light, sound, taste, or touch. For example, a person with autism might be oversensitive to light, feeling overwhelmed or anxious in brightly lit environments. On the flip side, they might be undersensitive to touch, not reacting to things like a minor cut that would usually cause discomfort in others. They could be highly focused on interest or hobbies. This intense focus can often lead to becoming an expert in that area, with a strong preference for discussing or engaging in activities related to the specific interest. Unfortunately, extreme anxiety is also a common characteristic for autism. This can be a result of a sudden, unexpected shift in routine where they feel out of control in an unfamiliar situation, which can result in our last characteristic, which is meltdowns or shutdowns. A meltdown can look like uncontrollable crying, yelling, or having difficulty calming down until the environment is adjusted or they can retreat to a quieter place. While a shutdown might cause them to stop responding to others or become nonverbal. If this happens, it's important to give them time and space to process and recover. So, what causes autism? The exact cause of autism has not yet been determined by scientists. Autism is primarily a biological condition, and many biological factors, including genes, brain anatomy, and pathways, are thought to play a role in the disorder. In addition to biological factors, environmental factors that contribute to autism include exposure to harmful chemicals and radiation, maternal infection, and exposure to maternal medications during the early stage of pregnancy. While the exact causes of autism are still unclear, it is clear that individuals with autism can lead fulfilling lives with the right support. So, how is autism diagnosed? It can be done during observations conducted by medical or psychological professionals and their parents, and the parents of the child, or through the use of screening assessments, including a physical evaluation conducted by a practitioner and a psychological evaluation based on the DSM 5 criteria. Some diagnoses start with a pre-referral or referral from a medical professional or the parents for early intervention. In this instance, a child might be referred for early intervention services by a pediatrician where they can provide more detailed screening and evaluation. This may involve the use of developmental screening tools such as the MCHAT, or a referral to a specialist such as a developmental pediatrician or child psychologist for a more in-depth evaluation and then diagnosis. Additionally, a non-discriminatory evaluation process is a diagnostic option that includes various tools used to cover three main domains, which are language communication, reciprocal social interactions, and restricted, repetitive, and stereotyped behaviors and interests. So let's talk about strategies for instruction. It is so important that educators use prompts and visual cues to demonstrate how they want things done. It is a highly effective strategy because it helps reduce student anxiety by clarifying expectation and reinforcing routines. It is important to note that visual cues should be shown to the student before or during the task, and the visuals need to be consistent. It is also a good idea to avoid assigning a visual and auditory task at the same time, because these students frequently struggle to process two inputs at once. This is because many autistic students have additional sensory processing disorder challenges. So instead, reduce the verbal instruction to a minimum and show a clear visual example and allow the students to focus solely on the task. Similarly, if you're giving an auditory instruction like please sit down, make sure that there are no visual distractions, because in this situation, you'll be competing for the student's attention. Another great strategy is to give clear instructions and then either write them down or double check that the student wrote them correctly. When you do need to give instructions, keep them short and simple to help the student process one instruction at a time. Educators should honor their students' preference regarding eye contact. Instead, allow them to engage in a way that feels comfortable for them regarding eye contact. This shows respect for their boundaries, and it creates a safe and structured environment where the student knows that they do not need to make eye contact to show that they are paying attention. It is also a good idea to use social stories or social scripting strategies to help students get ready for new experiences, events, or routine changes. These strategies provide clear, structured information about what to expect and how to handle different social situations. Teachers should have fun and make the most of their students' interests and strengths and incorporate those into their lessons. This makes learning more engaging, relevant, and motivating for them. For instance, if a student loves animals, you could create a word problem that involves animals. For example, if there are 5 lions and 3 more lions join them, how many lions are there in total? Lastly, it is helpful for these students if you provide them with social scripts to help them with peer interactions. Social scripts are simple, structured phrases or responses that can guide students through specific social exchanges. These scripts help reduce anxiety by clarifying expectations and building confidence in students with autism. Let's end this presentation with a few interesting facts. Did you know that research on the cause of autism is one of the most heavily funded areas across the entire disability field? While there is still so much to discover, the funding for autism research has created new avenues for understanding and supporting these individuals. Did you know that there is no connection between vaccines and autism? Over the years, a lot of research has been done on this topic, and the findings have conclusively demonstrated that there is no connection. Vaccines are also essential for public health, and it should be noted that their benefits far outweigh any minimal risks that might be associated with them, although autism most certainly does not. Did you know that 1 in 36 children in the United States are diagnosed with autism spectrum disorder? That is why it is essential that we foster inclusive communities, provide effective interventions, and support research into autism. Did you know that around 40% of children with autism do not speak at all? However, the fact that many individuals with autism are nonverbal does not mean that they cannot understand language or have thoughts and feelings. That is why it is so important to provide support and opportunities where they can communicate in a way that works for them. Lastly, did you know that autistic individuals are prone to being visual learners? Their brains may be more attuned to visual cues that they might find it easier to make sense of information when it is visualized rather than explained verbally. Being a visual learner can be a valuable strength for many of these individuals. In conclusion, it is important to remember that each person with autism is unique, with their own strengths, challenges, and ways of experiencing the world. By understanding autism better, offering supports that align with individual needs, and fostering inclusive environments, we can help those with autism thrive and lead fulfilling lives. Thank you for taking the time to learn more about autism. It is through awareness, empathy, and education that we can create a world that truly supports and celebrates neurodiversity. Again, I'm Andrea Hart, and I hope that you have a beautiful day in your own unique way.